Here's a crazy scenario, but one that happens way too often to think that it can't happen to your mom or dad when they're in a nursing home. They get beat up, or worse, sexually assaulted by a fellow resident at the nursing home. Can the nursing home be held liable? The theoretical answer is yes, but the challenges to getting there can be enormous. I'll explain. My name is Barry Doyle, and I'm a lawyer handling nursing home abuse and neglect cases throughout the state of Illinois. Nursing homes have an obligation to keep their residents safe from injury, and that includes not only from things like falls or bed sores or choking accidents, but also from assaults from fellow residents. So how do things like this happen? Usually the perpetrator has some cognitive deficit due to either mental illness or advanced dementia, and often there's no accompanying physical deficit, so that they're able to act out physically in a normal way, but without the behavioral constraints that most people have. On the flip side, you have other nursing home residents who have one or both physical and cognitive limitations, which keep them from being able to either resist or summon help. So when the perpetrator acts out, they're not able to resist what's happening. Nursing homes are constantly assessing residents, and when appropriate, they do make assessments of the risk that one resident has for being a perpetrator of abuse against a fellow resident. And when that potential is recognized, the nursing home has an obligation to take steps to keep other residents in the nursing home safe. This may include putting behavioral interventions in place, placing them under observation, making sure that all of the staff are aware of the potential of being a perpetrator of abuse, or referring the resident for psychiatric evaluation. To win a case where there's been an assault perpetrated by a fellow resident, we need to be able to show that there was a reason for the staff to be aware that there was a potential for the other resident to be a perpetrator of abuse, and that they failed to take reasonable steps to prevent it. So if a nursing home has an obligation to protect residents from abuse, what makes pursuing a case against a nursing home difficult if your mom or dad is assaulted by another resident? The first and biggest barrier you're going to run into is getting information about the perpetrator. As a nursing home resident, the perpetrator has a right to confidentiality under HIPAA if they're receiving mental health services, also under another statute called the Mental Health and Developmental Disabilities Confidentiality Act. What will happen is the nursing home will tell us that they can't release any information about the perpetrator, not even their name, or acknowledge that they're a resident of the facility. Why? The confidentiality rights of the perpetrator. And what's really happening there is that the perpetrator's confidentiality rights essentially becomes a shield against liability for the nursing home. It is 100% not the reason why those confidentiality rights exist, but they end up being an effective shield. So how do you get past that barrier? The strategy that we've been using most successfully is naming the perpetrator as an additional defendant in the lawsuit, and then trading a dismissal from the lawsuit in return for a waiver of the perpetrator's confidentiality rights. In other words, we let them out of the lawsuit in return for them allowing us access to the information in their chart, which will allow us to prove our case against the nursing home. Once we obtain that waiver, that takes away the shield that the nursing home is using to protect themselves from liability under the guise of protecting the perpetrator's confidentiality rights. And once that shield is stripped away, we usually find documented evidence of other aggressive and threatening actions against other residents and staff members, and just as often we find that there's been no formal assessment of the resident's risk of being a perpetrator of abuse. And sometimes we find that there's a relevant care plan, but it's bare bones, and in truth, we find that the steps, even the minimal steps that's in there, were never being carried out. In short, accessing the records of the perpetrator gives us plenty of ammunition to win our fight with the nursing home. If you think that this was interesting, check out this one here.